Around the big country, more employees are using their sick days as COVID cases tick upwards. So we are moving back to masks and lockdowns.
Well, maybe. KTAB's Noah McKinney takes us through what the local plan is moving forward, as well as handling something new, monkeypox. That's tonight's top story.
COVID cases are on the rise once again, says Abilene-Taylor County Public Health Director Annette Lerma.
I think last week we saw a 67% increase from the week prior.
And Hendrick's COVID-19 community safety dial has gone up a notch as well.
We recently, this past Monday, went to level 3. And we based that on our CDC community level, which we have moved from a low to moderate.
Hendrick Health Chief Medical Officer Dr. Rob Wiley says this uptick brings no change in hospital procedure, but should indicate a heightened level of concern.
When we move to level 4 within our hospital, we will start masking and screening, limiting visitation. So we're right up against that.
As for the current plan of action, both officials agree the public should be COVID cautious.
We can self-manage at this point. Hopefully the majority of us take your home test. If you're positive, stay home for a minimum of 5 days.
We're masking if you've been exposed or if you're positive.
We've learned a lot about COVID in the past 2.5 years, but we know far less about monkeypox.
Fairly contagious, but you have to come into direct contact with a blister.
This disease so far observed to be transmitted through skin-to-skin contact.
It's a disservice to the general population to make everybody think that they are at risk of monkeypox just by going out and doing their normal activities.
And one demographic does seem to be at higher risk.
All the cases within Texas currently are male, and they are gay and bisexual men. We're not trying to stigmatize or anything like that. We want them to be armed with information.
A campaign to inform is also what James Wagstaff of Big Country AIDS Resources says is necessary at this early stage.
Not listening to some misinformation, but really knowing the facts and figuring out, what you need to do to reduce your exposure.
Knowing how it spreads and keeping an eye out for its symptoms.
We always want to approach things from a prevention standpoint.
For BigCountryHomepage.com, I'm Noah McKinney.
Thank you, Noah. A vaccine for monkeypox has already gotten CDC approval and is being distributed in urban areas. Lerma says she's trying to secure a minimum order of those vaccines for Taylor County, but is not sure when those may arrive.